Welcome to the module, Pneumococcal Vaccine, What You Need to Know, a Frontline Forces training presented by Superior Health Quality Alliance, or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in the home. This course will provide a review of pneumococcal disease and the pneumococcal vaccine and will build on your current knowledge of vaccinations. Direct caregivers play a critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of these individuals. The purpose of this course is to further your learning about vaccines and vaccinations and how to use this information. What you know and do improves the quality and safety of the patients you care for. This learning module, Pneumococcal Vaccine, What You Need to Know, is part of a series of modules exploring different types of vaccines that are helpful in keeping both caregivers and the patients they care for safe and healthy. You are viewing the fourth module of the series, which provides a general overview of the pneumococcal disease and the pneumococcal vaccine. It is not necessary to complete the entire series in one sitting. You can leave and return to any of the modules in the series at any time. Once you have completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. Upon completion of this module, you will be able to describe complications of pneumonia, describe the types of pneumococcal vaccinations, explain who should get the pneumococcal vaccine and when, discuss the importance of getting the pneumococcal vaccine, and finally, describe the side effects of the pneumococcal vaccine. Before learning about pneumococcal diseases, it is important to have basic understanding of pneumonia. Pneumonia is an infection of one or both of the lungs and can be caused by viruses, bacteria, and/or fungi. It is a serious infection in which the air sacs fill with pus and other liquid. Common causes of viral pneumonia in the United States include influenza viruses, respiratory syncytial virus, or RSV, and SARS-CoV-2, the virus that causes COVID-19. Pneumococcal vaccines can protect against bacterial pneumonia. The most common is Streptococcus pneumoniae. Healthcare professionals describe the type of pneumonia a person has based on where they got the infection. Community-acquired pneumonia. This is when someone develops pneumonia in the community, not at a hospital. This also includes aspiration pneumonia, which happens when you breathe food, fluid, or vomit into your lungs. Healthcare-associated pneumonia. This is when someone develops pneumonia during or following a stay in a healthcare setting. Healthcare settings include hospitals, long-term care facilities, and dialysis centers. Ventilator-associated pneumonia. This is when someone gets pneumonia after being on a ventilator, a machine that supports breathing. Bacteria called Streptococcus pneumoniae, or pneumococcus, can cause many types of infections, some of which can be life-threatening. Streptococcus pneumoniae is spread when people cough or sneeze while in close contact with others who then breathe in the bacteria. Besides causing bacterial pneumonia, Streptococcus pneumoniae can also cause bacteremia, which is a blood infection, sinusitis, more commonly known as a sinus infection, meningitis, which is inflammation or swelling of the protective membranes covering the brain and spinal cord. This is typically caused by a bacterial or viral infection of the fluids surrounding the brain and spinal cord. Similar to pneumonia, there are three types of meningitis: bacterial, viral, and fungal. Bacterial meningitis can be caused by Streptococcus pneumoniae, and the pneumococcal vaccine can protect against bacterial meningitis. Otitis media, which is a middle ear infection. Streptococcus pneumoniae bacterial infections that cause these illnesses can be prevented by getting a pneumococcal vaccine. Pneumococcal disease can cause significant complications, even death. Pneumonia can cause empyema, or a collection of pus in the lungs, pericarditis, or swelling and irritation of the tissue surrounding the heart, and endobronchial obstruction, which can cause atelectasis, or the collapse of the lung, and abscess. Pneumococcal pneumonia kills about 1 in 20 who get it. Meningitis can cause seizures, coma, hearing loss, developmental delay, or even death. Unfortunately, 1 in 12 children and 1 in 6 older adults who get pneumococcal meningitis die of the infection. Blood infection caused by Streptococcus pneumoniae bacteria can cause a loss of limbs, and 1 in 30 children and 1 in 8 adults die from pneumococcal bacteremia. Pneumococcal diseases can cause significant illness and even death for people of all ages. The risks for pneumococcal disease complications are greater for children younger than 2, adults 65 years or older, adults suffering from alcoholism, those who have chronic heart, lung, kidney, or liver disease, those with cochlear implants, cerebral spinal fluid leaks, diabetes, HIV infection, cancer, organ transplants, or anyone with weakened immune systems, people with nephrotic syndrome, sickle cell disease, a damaged spleen or no spleen, and those who smoke cigarettes. For those that fall under these categories, the pneumococcal vaccine can help protect them from serious illness. There are 4 different pneumococcal vaccines: 3 pneumococcal conjugate vaccines, PCV13, PCV15, and PCV20, and 1 polysaccharide vaccine, PPSV23. Conjugate vaccines are a type of vaccine that joins a protein to an antigen to improve the protection the vaccine provides. Polysaccharide vaccines are a type of vaccine composed of long chains of sugar molecules that resemble the surface of certain types of bacteria to help the immune system mount a response. Pneumococcal vaccines do not contain a live virus, so they cannot cause a pneumococcal illness. Pneumococcal diseases are spread from person to person through touching, kissing, coughing, or sneezing. Anyone can get a pneumococcal infection, and reinfections are possible. Luckily, the pneumococcal vaccine can reduce the risk of pneumococcal-associated hospitalization. You are likely familiar with the seasonal influenza vaccine. Pneumococcal diseases can occur year-round, so they are not seasonal. Because of this, you can get the pneumococcal vaccine at any time throughout the year. Pneumococcal vaccinations are highly effective, but similar to other vaccine-preventable illnesses, vaccination does not guarantee protection against pneumococcal disease. People who get vaccinated might still get sick. Studies show that the PPSV23 or polysaccharide vaccine is 60 to 70% effective at preventing invasive pneumococcal disease. PCV13, one of the conjugate vaccines, showed 46% efficacy against vaccine-type pneumococcal pneumonia. The other conjugate vaccines, PCV15 and PCV20, produced similar results. As mentioned in a previous slide, anyone can get a pneumococcal infection. Babies, adults 65 years or older, and children and adults with certain long-term health conditions should get the pneumococcal vaccine at the recommended times. Since you can get pneumococcal diseases more than once, a previous infection does not prevent someone from getting sick in the future. It is important to get a pneumococcal vaccine even if you have had a pneumococcal illness in the past. The recommendations can be confusing for pneumococcal vaccinations. There are specific recommendations based on age. For all children younger than 2 years of age, PCV13 or PCV15 vaccines are recommended for infants as a series of 4 doses, 1 dose at each of these ages: 2 months, 4 months, 6 months, and 12 through 15 months. The recommendations for adults are dependent on if the person received a pneumococcal vaccine in the past. If an adult aged 65 years and older received a PPSV23 vaccine in the past, they should get 1 dose of either PCV15 or PCV20 at least 1 year after the PPSV23 vaccine. If they received 1 dose of PCV13 in the past, they should receive 1 dose of PPSV23 or 1 dose of PCV20. If an adult aged 65 years and older has not received a pneumococcal vaccine in the past, or if they are unsure if they received one in the past, they should get 1 dose of PCV15 and 1 dose of PPSV23 at least 1 year later, or receive just 1 dose of PCV20. The PCV20 vaccine is a great option because it only requires 1 dose. The same guidance can be used for adults 19 to 64 years of age that have the following risk factors: chronic medical conditions such as heart, lung, kidney or liver disease or diabetes, conditions that weaken the immune system such as sickle cell disease, HIV/AIDS, cancer, or damaged or missing spleen, cochlear implants or cerebrospinal fluid leaks, alcoholism, or if they are a smoker. Pneumococcal vaccination recommendations are complex, but great tools exist to determine which vaccine type someone should receive, including the Pneumorex VaxAdvisor tool, provided by the Centers for Disease Control and Prevention, or the CDC. This link to this tool can be found on the Frontline Forces webpage or in the YouTube description. Most people do not have serious problems with the pneumococcal vaccine. If side effects happen, they tend to be mild. There are different side effects for the conjugate vaccines versus the polysaccharide vaccine. Both vaccine types do include possible reaction site irritation and fever, feeling tired, and muscle aches. The conjugate vaccines can cause additional side effects such as headache, chills, and muscle aches. There are only a few reasons why someone might not want to get the pneumococcal vaccine. People with severe life-threatening allergies should talk with their vaccination provider prior to getting a pneumococcal vaccine. People with mild illnesses, like a cold, can still get vaccinated, but those who are severely ill should usually wait until they recover before getting a pneumococcal vaccine. People who have had reactions to previous vaccinations should talk with their vaccination provider prior to getting another pneumococcal vaccine. It is very important to ensure that racial and ethnic minorities get the pneumococcal vaccine. Racial and ethnic minorities experience pneumococcal disease at higher rates than whites. There are significant differences in length of stay and costs of pneumococcal disease hospitalizations between U.S. Black and non-Black populations. Data does show that the PCV13 vaccine is associated with a large decrease in the overall incidence of invasive pneumococcal disease, and that those types of race-based pneumococcal disease disparities are markedly reduced because of the PCV13 vaccine. This is encouraging news, and healthcare providers should explain these disparities to their patients when making recommendations. Congratulations! You have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the pneumococcal vaccine quiz on the Frontline Forces webpage or in the YouTube description below. These references are accessible on the Frontline Forces website or in the YouTube description below. This material was prepared by the Superior Health Quality Alliance under contract with the Centers for Medicare and Medicaid Services, an agency of the U.S. Department of Health and Human Services.